Hello everyone. So today we'll be discussing and teaching how to discuss OHI, which is oral hygiene index, with a patient who is sitting in your chair. I will be playing both roles as the student hygienist and as a patient who has ortho. One of the major problems with ortho is a lot of people go from regular brushing habits with nothing on their teeth to trying to use those same techniques with brackets, and you end up having a lot of inflammation. Plaque begins to build up because you have so many nooks and crannies, and it's very hard to brush in those areas. Also, when that plaque stays there for a long time, you get decalcification and you have a higher risk of gum disease. Keep in mind that when you're talking to a patient, you won't be using a lot of scientific words or medical terms because a lot of people don't talk like that in normal life, and you have to try your best to speak in a way that your patient will understand, or your client. And I will be showing how to brush, the types of brushing you need to do with braces, and how to floss with braces, and how to use oral rinses, and even disclosing agents to get your patients to learn how their brushing is affecting their daily life and how they can make it better. Also, keep in mind, you always want to ask open-ended questions to your patients because you don't want to just sit there and have yes or no. You always want to get details about their daily habits, what is happening in terms of their health, and why they're doing the things that they do. It also makes for a better appointment and they become more comfortable with you. Also, always check up with their medical history. Ask them if anything has changed in the last 6 months, if it's a recall, and if they've had anything like major life-changing things happen. It does make for a better appointment, and it does give you more information as to how you can apply this to their oral health and oral hygiene. I mean, I've noticed that I'm starting to bleed a lot when I'm brushing and flossing my teeth, and my gums really hurt all of a sudden, and they're looking puffier than usual. I don't know why. I brush twice a day. I floss once a day. It's driving me crazy. I just don't know what to do anymore. I mean, those are all reasonable concerns that you should have, especially as a new ortho patient. I would love to see how you're brushing, just to get an assessment of where we're standing and what might cause this inflammation and plaque buildup that you're talking about.
I go like this, and I just get all these spaces right here, right? That's all I do.
Usually takes me like a minute a day. Thank you so much. That was a really good job. Some things I just have to tell you is you're just being a little too rough. Everyone thinks, you're not the only one, that you have to go super, super hard just to get everything out of there, all the food and the plaque and stuff. But the key trick is light strokes, not a lot of pressure. And especially with braces, you want to angle the toothbrush at a degree that hits those teeth. So you don't want to come from below or sideways. You want to come from above in order to get all that plaque and gunk and even food that's stuck in those brackets there. To help show you what areas you're missing, I'm also going to put some disclosing agent on you. What it does is it shows you all the plaque and tartar you're leaving behind. It colors it so you can see what areas you're missing, okay? So I'm going to show you while you hold a mirror. I'm going to try doing it on your teeth, and then I'm going to see if you can do it yourself, okay? So with this brushing technique, which is called the charter technique, your toothbrush is directed towards the edges of your teeth, and you're going to do short back and forth vibrating strokes in order to dislodge any plaque, food, and the way you get all this food out is from these short little strokes that help get everything, especially those little nooks and crannies that are caused by the brackets. So now I want to see you do it on yourself. So this is going to teach me how to do it. All right, let me see. Wow, I missed a lot of things in my teeth before. And I'm just supposed to be pressing it down like this, right? Yeah, all the slack is coming off. Wow. And it doesn't even hurt me. Thank you. That's perfect. And so now don't forget the inside of your teeth where your tongue and your palate is. That you can just use regular brushing techniques where you're just going in circular motions, aiming at the gums, and then you wiggle it for a little bit and then you slide down to get all that plaque off. You don't have brackets on those areas, so it's much easier. And it also helps get rid of all that plaque that's on that side. So Adina, how are you flossing every day? I mean, I bought that really expensive water pick, so I don't use regular floss anymore. And that's just what I use every night, right? Like, that's okay, right? So as cool and expensive as water picks are, they're not disrupting that bacterial layer that's going to be forming every time you leave food in your mouth. What I do recommend with water flossing is super floss. It's very easy to thread in and out of your braces, and it gets rid of all that plaque and all that food that might be stuck in there. I'm going to show you real quickly on myself, and then I'm going to have you do it on yourself, okay? The way super floss works is it has a pointy end that you stick in to the tooth. Like this. You always do it opposite for the bottom part. You're going to wrap it around your middle fingers. And use your index and pointers to get a grip. Then you're going to curve it in a C motion against the tooth like this for this side and this for this side. And you're going to pull it all the way up like this. And then you're going to thread it out. And you should be done. So for time purposes, I'm just quickly going to explain that the patient will continuously repeat the action that you're showing them. Afterwards, you can recommend other things for ortho patients, such as proxy brushes, which help dislodge plaque in the interproximal areas of the teeth. And then you would also recommend an antimicrobial mouth rinse that helps reduce inflammation and plaque buildup in that person. At the very end of the appointment, you want to continue motivational interviewing and ask open-ended questions like, what ways would you implement what I taught you today? How would you put this into your daily routine? And do you think this would benefit you, and in what ways would it? And that is the end.